Good morning, everyone, and welcome to our Grand Rounds event today. Whether you're joining us from inside of the Rango's Auditorium or somewhere else virtually, as I am here in my Oakland office, we thank you for taking time to attend this very special presentation. As a reminder to those of you who are attending virtually, there is actually not a separate link for the meet and greet. The Admiral has saved time for Q&A at the end. If you would like to ask a question, make a comment for the Admiral, and you are attending virtually, just put that in the chat and we will ask the question. And then for those of you who are there in person, you can just raise your hand and a microphone will magically find its way to you. So with that, we are so very honored and excited to have Admiral Rachel Levine join us for Grand Rounds, which is our inaugural presentation for our second annual DEI Symposium, whose theme this year is the intersectionality of diversity. We know that we are all genetically 99.9% the same, and yet we have many variations in our identity, from our ancestral background, the languages we speak, the spectrum of gender and sexuality, abilities, disabilities, religions, and I'm sure there are many people who would think of others. Any individual will have more than one of these identities as part of who they are. Today, we are fortunate to have speakers highlighting many of these. We begin with Admiral Levine, who will speak with us on the challenges and opportunities facing adolescent health today. Admiral Rachel L. Levine serves as the 17th Assistant Secretary for Health for the U.S. Department of Health and Human Services and is the head of U.S. Public Health Service Commission Corps. She fights every day, as she always has, to improve the health and well-being of all Americans. She's working to help our nation overcome the COVID-19 pandemic and build a stronger foundation for a healthier future, one in which every American can attain their full health potential. Admiral Levine's very storied career began first as a physician in academic medicine, focused on the intersection between mental and physical health, treating children, adolescents, and young adults. Then, right here in Pennsylvania as our physician general, and later as Pennsylvania's Secretary of Health, she addressed COVID-19, the opioid crisis, behavioral health, and other public health challenges. Once again, we are so pleased and honored to have her take time out of her incredibly busy schedule to be back with us here in Pennsylvania. Thank you, and I give you Admiral Rachel Levine.
Well, thank you so much, Dr. Matheo. I really appreciate that wonderful introduction. And it is great to be back, at least virtually, at UPMC and at the Children's Hospital, and to be speaking with you today. So thank you for the invitation. So, and I'm going to be going PowerPointless, always now without a net. So I was called to medicine, as many of you were, by my desire to help people and work towards the common good. Our medical education gives us very important skills, but what makes us physicians, nurses, many other medical professionals is our choice to spend our days, and as you know, often our nights, helping our fellow human beings live well. Medicine is about saving lives, but also about improving the quality of life. We are there for emergencies. We are there for pandemics. We're there whenever our patients and families need us. We work to try to make sure the sick get better. We help healthy people stay healthy. And we try to make sure that those who need professional medical help receive that help, no matter who they are or what their life circumstances might be. We learn to treat patients without discrimination. And we work every day to benefit the sick, to protect people from harm, but also to make our community whole. We can do that with medicine, but we can do that with warmth, empathy, compassion, and understanding. Our communities need healing. Our nation needs healing now more than ever. But I want to draw your attention to that many young people living in this country are being attacked, and they feel that they have few places to turn. Lesbian, gay, bisexual, transgender, queer and questioning, and intersex Americans, especially our youth, are attempting suicide at an alarming rate. According to the Centers for Disease Control and Prevention, Adolescent Behaviors and Experiences Survey, covering January to June of 2021, which was just published in April of this year, 1 in 4 teenagers who identified as LGBTQ+ reported attempting suicide during the first half of 2021. They didn't just consider suicide. This wasn't suicidal ideation. They had attempted suicide, 1 in 4. Just as alarming, 46.8%, essentially 47% of teens who said that they are lesbian, gay, bisexual, considered a suicide attempt during that time frame. The CDC found that compared to cisgender heterosexual students, LGBTQI plus respondents reported higher percentages of poor mental health during the pandemic, persistent feelings of sadness or hopelessness, and fewer connections to others at school. There was a brief in September 2020 entitled, I'm kind of stuck at home with unsupportive parents right now. This was in the Journal of Adolescent Health, LGBTQ youth experiences with COVID-19 and the importance of online support. This was published about after youth had been socially distancing. The brief found that LGBTQ youth were facing considerable additional stressors while staying at home and studying remotely, in addition to those faced by their non-LGBTQ peers. Youth remarked that they were leery of conducting therapy sessions over the phone while they were at home for fear of being overheard by their parents. They felt that they were unable to express themselves or live fully in their identities. And they were, as the paper's title suggests, feeling trapped at home with unsupportive parents and family members. The authors noted at the time, given the potential for long-term physical distancing, concerted efforts are required to provide necessary resources and support for LGBTQ youth during the COVID-19 pandemic. The data we have about suicide attempts and suicidal ideation among this population suggests that not enough resources and support have been brought to bear. For the Trevor Project's 2022 National Survey on LGBTQ youth mental health, based on responses from almost 34,000 LGBTQ youth aged 13 to 24, they found that 56% of these youth reported their mental health as poor, most of the time or always, due to the COVID-19 pandemic. A 2019 report that drew on data from the same type of survey, now this was administered before the pandemic, found that youth with at least one accepting adult, didn't have to be a parent or a family member, were 40% less likely to report a suicide attempt. So often it takes very little, one accepting adult, to significantly reduce the risk of LGBTQI plus suicide. The health disparities experienced by LGBTQI plus people of color are often even more inequitable than those of their white peers. A recent paper from the Williams Institute at UCLA found that LGBTQI plus people of color are more likely to be uninsured, more likely to report poor or fair health, and more likely to fear judgment, feeling judged in healthcare settings. So reducing disparities in the LGBTQI plus community must take intentional account of systemic racism and implicit bias. None of us make progress unless we have all made progress. The Department of Health and Human Services has made improving and supporting Americans' mental health a top priority, particularly for our youth. Surgeon General Murthy has spoken often of the need for better and more effective mental health supports, and he published an advisory last year entitled Protecting Youth Mental Health. So, given that half of LGBTQI plus youth in this country are considering suicide, we need to take these recommendations with a sense of urgency. And it is just so challenging and tragic that even after decades of social progress, the most vulnerable among us continue to suffer, including LGBTQI plus individuals of color, youth, seniors, and immigrants. Transgender women of color who live at the intersection of multiple systems of oppression, that intersectionality, are even more likely than the general population to suffer not just discrimination or bullying, but actually violence and even murder. Thus, this is a day-to-day reality that many Americans face. And again, we have not made progress unless we have all made progress. The transgender population in particular faces significant health disparities. Now, the largest survey to date was the 2015 US Transgender Survey, and it found that respondents faced high levels of mistreatment and violence, severe economic hardship and housing challenges, and the harmful effects of stigma and discrimination, which impacts both their physical and mental health. As highlighted in a 2020 report from the National Academies of Science, Engineering, and Medicine, entitled Understanding the Well-Being of LGBTQI plus Populations, transgender and non-binary people face increased risk of sexually transmitted infections such as HIV, chronic conditions such as cardiovascular disease, and psychiatric comorbidities such as depression and anxiety when compared to the general population. Now, these negative health and life outcomes are being misrepresented in many states around our country for political purposes. They are frequently described as the inevitable result of mental illness. They are described as unpreventable struggles faced by unfortunate people, rather than the lack of compassion and challenging access to professional medical care. Numerous articles have noted that there is nothing inherent about being LGBTQ+, nothing inherent about being transgender that predisposes youth and adults to negative health, these negative medical and mental health outcomes. It is the bullying, the harassment, and the discrimination that particularly transgender youth face, which leads to these outcomes and these conditions. Transgender youth who are supported by their parents, school, and community, and receive evidence-based care actually have excellent mental health outcomes. Studies clearly show that gender-affirming care results in these positive mental health outcomes. Gender-affirming care is medical care. Gender-affirming care is mental health care. And gender-affirming care is literally suicide prevention care. This fact is well established in a collection of 16 studies highlighted earlier this year by Stanford University School of Medicine. Trans youth receiving gender-affirming care reported lower depression, higher mental health quality, and less suicidality than their peers without care. In February 2022, a team of researchers in a paper in JAMA Network Open titled Mental Health Outcomes in Transgender and Non-Binary Youth Receiving Gender-Affirming Care found that trans and non-binary youth who went on puberty blockers or hormones had 60% lower odds of depression and 73% lower odds of suicidality over a 12-month period compared with those who did not. The American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, the Academy of Child and Adolescent Psychiatry, the Endocrine Society, the Pediatric Endocrine Society, our Society for Adolescent Health and Medicine, and the World Professional Association for Transgender Health, among other professional groups, all agree that gender-affirming care is medically necessary. It is safe and effective for transgender and non-binary children and adolescents. And this process is tailored to individuals with parental input. I want to highlight that WPATH just published new standards of care 2 weeks ago. An authoritative guide to treatment and patient care is located in the Endocrine Society's clinical practice guideline published in September of 2017 in the Journal of Clinical Endocrinology and Metabolism. That document is entitled Endocrine Treatment of Gender Dysphoric, Gender Incongruent Persons. And there's hopefully with the new WPATH guidelines, a new Endocrine Society guideline will be published hopefully in the next year. We know that family acceptance and appropriate medical intervention bring measurable benefits to young people's quality of life. We do not need laws and actions in states that dictate the principles of transgender medical care for youth and adults. Now, one challenging source in the literature was published in 2018 by Dr. Lisa Littman of Brown University in PLOS 1, entitled Parents' Reports of Adolescents and Young Adults Perceived to Show Signs of Rapid Onset of Gender Dysphoria. This article warned of a quote-unquote trans epidemic plaguing teenage girls and a quote-unquote contagion of transgender self-identification. Now, this report has been widely criticized for bias and methodological flaws, and it was only republished after extensive edits were mandated by the journal's editors. In fact, there is medical evidence that we do not have. There is evidence that we do not have widespread socially created phenomenon of transgender self-identification. One June 2019 paper published in Translational Andrology and Neurology was entitled Demographic and Temporal Trends in Transgender Identities and Gender Confirming Surgery. And this highlighted that it is indeed true that more people living in this country are identifying as transgender or gender non-binary. But they note that the wider medical literature attributes this increase to better survey methods, greater social acceptance and visibility, rather than any societal changes that have increased the actual rate of transgender self-identification. The data show that trans and non-binary young people identify as such when they are relatively young age. And the authors noted that these findings were consistent across age groups. And the report suggests that growing trans and non-binary prevalence are attributed to increasing awareness, acceptance, and self-reporting rather than an actual increase in prevalence. And there's a recent study, I believe in the journal Pediatrics, which also highlights this fact with different types of data. Now, the best estimate drawn from CDC's 2017 Youth Behavior Risk Survey is that about 1.8% of US youth identify as transgender. The Trevor Project found that many children and adolescents who identify as LGBTQ+ avoid athletic participation due to actual or feared discrimination. Now, this is consistent with a report from the Center for American Progress in 2021 entitled Fair Play, the Importance of Sports Participation for Transgender Youth. Now, this report found that only 42% of trans youth participates in sports. So, different laws and actions by states are targeting a very small minority of youth that are participating in sports. Now, there have been many actions and laws in states throughout the country limiting transgender youth participation in sports. Now, Governor Spencer Cox of Utah published an impassioned statement in vetoing his House bill in Utah, which blocks transgender youth from playing sports with other students of their gender. And he pointed out that of the approximately 75,000 students participating in high school sports in Utah, the law applied to 4 individuals. 4 individuals. He stated, quote, "Really has so much fear and anger been directed at so few." He stated, "I do not understand what they are going through or why they feel the way they do, but I want to live." His veto was overridden by the state legislature, and that law is currently in place. Now, the Healthy People 2030 report is through our office of the Assistant Secretary for Health, and it includes several important national public health goals specific to this population that we're discussing. It's worth naming them to get a sense of how acute and pervasive these health risks are. The objectives include reducing bullying of transgender students, reducing the proportion of transgender high school students who have used illicit drugs, reducing suicidal thoughts in transgender students, increasing the number of national surveys that collect data on transgender community, increasing the number of states, territories, and the District of Columbia that use the standard module on sexual orientation and gender identity in the behavioral risk factor surveillance system, and others. President Biden and our administration see the LGBTQ+ community for all of its diversity. We have a president who supports equality and works to ensure that everyone is represented. And that approach to governing gives people a voice, a chance to affect change, and an opportunity to help people understand the diverse needs of our nation. About 3 or 4 months ago, during Pride Month, President Biden signed an executive order. I was just thrilled to be there on the podium to help promote equality in America to those in the LGBTQI+ community. Its main tenets included addressing discriminatory legislative acts against LGBTQI+ children and families, and directing key agencies in our government to protect families and children. Preventing so-called conversion therapy with an historic initiative to protect children from this harmful practice. Safeguarding healthcare and programs designed to prevent youth suicide. Supporting LGBTQI+ children and families by launching a new initiative to protect foster youth, prevent homelessness, and improve access to federal programs. Strengthening the federal collection of sexual orientation and gender identity, or SOGI, data. Supporting the national HIV/AIDS strategy to lead us towards ending the HIV epidemic in the United States by 2030. And taking new additional steps to advance LGBTQI+ equality. At HHS, Secretary Becerra, I, and our entire leadership team are committed to doing everything we can to help vulnerable patients and families get the medical care they need, no matter where they live, no matter their life circumstances. We firmly believe that medical and politically motivated medical discrimination against LGBTQI+ people has to end. For example, we have renewed focus on anti-discrimination protections against the LGBTQI+ community, which is critical because fear of discrimination can lead individuals to forego care, which can have, as you know, serious health consequences. HHS announced that and have now actually put forth regulations for public comment that we will enforce Section 1557 of the Affordable Care Act, and the Department of Education has said so for Title IX of the Education Act to prohibit discrimination on the basis of sexual orientation and gender identity. Those rules and regulations are out for public comment, After we respond to those comments, we will work to promulgate those rules. It is the position of the Department of Health and Human Services that everyone, including our LGBTQI+ community, should be able to access healthcare free from discrimination or interference, period. We clearly have more work to do. Today, many politicians and their supporters in many states in the country are literally describing our LGBTQI+ community as a blight upon our culture. Many of the targets, especially our youth, many of the targets of this kind of speech are driven to suicide. We know as a medical fact that trans youth in particular are being harassed in public and being driven to the depths of despair at an alarming rate. I want to point out again that for LGBTQI+ children, adolescents, and teenagers that you know that may be having mental health issues, the difference between life and death is often one single caring adult. Doesn't have to be a parent or a family member. It makes all the difference in the world to hear just one supportive person reminding you that you are a valuable human being, that your life is important, and that your life has dignity. Having one supportive person to bring them through these difficult times has saved the lives of more LGBTQ+ young people than we will ever know. It is so critically important, one supportive adult. That might be you. That might be their pediatrician or their nurse or their social worker or their therapist or their dietitian or their teacher or their coach, which makes the quote unquote "Don't Say Gay" bill in Florida and being considered in many other states, including Pennsylvania by the legislature, so challenging and so difficult and so egregious and so insidious. You know, trans people are doctors, they're lawyers, they're teachers. They run businesses, and they drive Lyft and Uber. Sometimes they're even the assistant secretary for health. I do not see enough warmth, empathy, or compassion or behalf on their understanding throughout the United States. I certainly have not seen it from those in states that target them for isolation, bullying, rejection, and anti-trans legislation and anti-trans actions. Our children are watching. They're watching what we do. They're watching what we say, and they're watching how we act. We need to say publicly to every LGBTQI+ person in this country that it is okay to be you. And it's the right thing for you to stand up for your dignity and your freedom. Now, how do we respond to this in the medical community? We need to speak as a medical community and express as clearly as possible about our compassion and about the non-discriminatory provision of medical care. Again, I feel that we have not as a society made progress unless we've made progress for all. Acts of intolerance damage our nation's health and well-being, including our mental health. Now, personally, I have no room in my heart for hatred, and frankly, I have no time for intolerance. We need to all work together against this intolerance until everyone living in America can live their life openly and freely without fear of prejudice, scorn, or attack. I believe that the lessons of recent history indicate that our mission as doctors and other medical nurses and other medical professionals needs to include a proactive rather than merely a passive rejection of this intolerance. You know, we have the ability to share information, to speak with authority that our training and experience have given us, and work together to assert our right to practice medicine as we were taught and to practice it without discrimination. So I encourage all of you to think of yourselves as ambassadors to your communities, ambassadors for science, ambassadors for compassion, and ambassadors for care. These conversations don't have to be limited or restricted to a medical setting. Offer yourselves as informational resources, not just for youth, but for school teachers, principals, school boards, professional organizations, recreation centers, county commissioners, and others who would benefit from this information and your perspective. Please proactively seek opportunities to speak about what you know. Our task is to educate the public in as many forums as possible. And we need to have these conversations that question the assumptions that are underlying today's attacks on trans people. Pushing back the veil of ignorance demands this extra effort. And this is the challenge before our profession. For almost 40 years now, I have considered it an honor to be a doctor. I believe in our role as healers. I believe in our role as truth tellers. And the truth that we need to confront now is that medicine and science are being politically perverted around this country that destroys human lives. And we have reached a tipping point for the role in medicine and civic life for the health and well-being of LGBTQI+ youth and other Americans. Those who attack our community are driven by an agenda of politics. It has nothing to do with medicine. It has nothing to do with science. It has nothing to do with warmth, empathy, compassion, or understanding. They are rejecting the value of supportive medicine, rejecting well-established science, and simply rejecting basic human compassion. We as doctors and as people who love our communities and love our nation have to confront the fact that the language of care and compassion that they're using is being taken for granted to literally tear our communities apart. So we have to stand up. We have to take a stand on behalf of those who are being hurt. That's what we do in medicine, even when it's difficult. Remember, one supportive adult. Thank you so much for your attention, and I'm pleased to answer your questions.
Thank you so very, very much, Admiral Levine, for just an amazing discussion about the evidence-based research, the societal issues and challenges facing our LGBTQ+ community, and how, as you said, we need to be the ambassadors. We need to take away that veil of ignorance. That is our duty. That is our job as healthcare providers. And I cannot thank you enough for your time.